Good evening, everyone. We are going to get started in 1 minute. Can I just get maybe Jessica, can you hear me?
Yep, I can hear you.
Great, thank you. Hey, good evening, everyone. Thank you all for being here. I want to begin today's meeting by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who lived and continue to live on this land. I would also like to recognize and honor the valuable contributions of the First Nations, Inuit, and Métis people who call this land their home. When we acknowledge the land, we remember unceded means that First Nations people never ceded or legally signed away their lands to the Crown or to Canada. When we speak of traditional territory, we speak of land they or their ancestors traditionally occupied and used. The land sustained them, and as stewards, they cared for the land and the waters that flowed through them for generations before their lives were irrevocably changed through colonization and forced assimilation through the residential school system. In the spirit of true reconciliation, as chair of the Board of Health, I commit to supporting Indigenous-led public health priorities by ensuring Indigenous knowledge, leadership, and lived experience help guide Ottawa Public Health's decisions and actions, and to advancing cultural safety, humility, and accountability across Ottawa Public Health so our policies and programs better serve Indigenous peoples in Ottawa. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination of all Indigenous people. Can we have the roll call, please?
Member Bauer,
Present.
Member Carr,
Here.
Member Chung, Member Dudas,
Present.
Member Gower,
Here.
Member King,
Here.
Member Ejiofor,
Present.
Member Grutenwald,
Here.
Member Bradley,
Here.
Vice Chair DiGiovanni,
Present.
and Chair Kitts.
Here.
We have quorum.
Thank you very much. There are no regrets this evening. Are there any declarations of interest? Seeing none, confirmation of minutes of the meeting of February 9th, 2026. Are these minutes confirmed? Thank you. There are 8 communication items that have been received and are held on file with the Board of Health Secretary. Motion to introduce reports. Member Carr, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Update on Ottawa Public Health's Dental Health Services Program, Ottawa Public Health 2025 Annual Report, Delegation of Authority, Contracts awarded for the period of July 1st to December 31st, 2025, 2025 Operating and Capital Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, and Performance Appraisal of Medical Officer of Health in camera personal matters about an identifiable individual. Reporting out date not to be reported out, be received and considered.
Thank you very much. Is this carried? Thank you. Okay, so item 7.1, Chair of the Board of Health verbal report will be held. Item 7.2, Medical Officer of Health verbal report will also be held. Item 7.3, update on Ottawa Public Health's Dental Health Services Program is going to be held for a presentation. Item 7.4, Ottawa Public Health 2025 Annual Report will also be held for a presentation. Item 7.5, Delegation of Authority, Contracts awarded for the period of July 1st to December 31st, 2025. Is this item received? Thank you. Item 7.6, 2025 Operating and Capital Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report. Is this item received? Wonderful. We also have item 9.1, performance appraisal of medical officer of health. If anyone wants to discuss this item, we will go in camera at the end of the meeting. But if not, is this item carried? Great, thank you. Okay. So we'll go back to item 7.1, Chair of the Board of Health verbal report. So again, good evening, Kwe, Anin, Shekan, Tanshi, Unukut, and good evening to everyone. I would like to begin by touching on the Health and Housing Symposium that was held on April 10th, which was co-hosted by the City of Ottawa, Ottawa Public Health, Ottawa Community Housing, Brial Health, the Royal, and the Ottawa Hospital. The symposium was focused on the actions needed to increase integrated health housing models already operating in Ottawa and exploring new community-driven approaches between housing, healthcare, and community service partners. Ces approches sont nécessaires pour mieux soutenir les personnes sans abri ou en situation de logement précaire, tout en allégeant la pression sur les hôpitaux et les services d'urgence. I was pleased to provide remarks to a packed audience of 250 attendees at the symposium and to announce the creation of a new health, housing, and homelessness action table as part of the citywide initiative focused on strengthening coordination. This action table, established under the city's Housing and Homelessness Leadership Table, will bring together housing providers, Ottawa Public Health, healthcare organizations, and community partners to strengthen coordination, build on what's already working, and bring action for better outcomes for people and the system. As part of the event, April 10th was declared Health and Housing Day in Ottawa, and partners also announced new philanthropic investment, including a $100,000 commitment from the RBC Foundation to support on-site health and social services in Ottawa community housing communities. As I said at the symposium, people who are experiencing homelessness need and deserve continuous and thoughtful care to get and keep well. We know housing stability is a determinant of health, and the discussion and collaboration I saw at the event is how we turn momentum into lasting change. Ottawa Public Health has helped lead this collaborative work with the City of Ottawa's housing and homelessness services partners and people with lived experience, and I know that the months ahead will build on the hope, trust, creativity, and commitment we share with our partners and the community to solve a complex problem for people who want to live their lives with dignity and purpose. Turning now to food insecurity, I would also like to note this board's continued support for efforts focused on addressing the root causes of food insecurity through income-based policy approaches. The board previously approved support for Federal Bill S-233, an earlier version under the former Parliament of what is now Bill 206, related to basic income advocacy, with a motion and letter sent to the Minister of Health and the Minister of Families, Children, and Social Development in July 2024. While that earlier version of the bill did not proceed before the last Parliament concluded, the issue has since returned for federal consideration, prompting a need for renewed advocacy from municipalities, public health agencies, and community partners. This position also aligns with the motion brought forward by Councillor Carr in September 2025 at Ottawa City Council and reflects collaboration between Ottawa Public Health, community safety and wellbeing partners, and other teams within community and social services. L'insécurité alimentaire demeure un problème de santé publique croissant dans notre communauté et y remédier exige des mesures allant au-delà des réponses d'urgence, notamment des approches politiques liées à l'adéquation des revenus, à l'accessibilité financière et au soutien social. In my capacity as chair, I therefore intend to write a renewed letter of support on behalf of the board to the Federal Minister of Health and the Federal Minister of Families, Children, and Social Development to formally endorse this advocacy and to reinforce the City of Ottawa's and Ottawa Public Health's commitment to this work. With respect to the recently tabled provincial budget, we saw limited references to public health. It would appear for now that the status quo for funding levels remains in place. Dr. Arneson has been engaged with his provincial counterparts to map out a path forward for a more balanced funding distribution across public health units. While this budget supports the continuation of core public health programs and essential services, ongoing cost pressures, Ottawa's growing population, workforce demands, and increasing community need continue to require careful stewardship. As a board, we will soon be coming together to begin discussions on our next strategic plan, and that engagement will be an important opportunity to consider how we continue to deliver on our mandate within these challenges. Santé publique Ottawa continuera de privilégier l'utilisation stratégique des ressources disponibles, la prévention, la collaboration avec ses partenaires et le repérage des possibilités d'innovation afin de maximiser son impact tout en répondant aux risques émergents et évolutifs pour la santé publique. Before concluding, I would like to acknowledge that May 5th marks the National Day of Awareness for Missing and Murdered Indigenous Women, Girls, and 2S LGBTQIA+ people. On this day, we remember those who have lost their lives to colonial gender-based violence and hold in our thoughts the families and communities living with the grief of loss of a loved one. This day also serves as an important reminder for us all to increase awareness of this ongoing crisis and commit to action in response to the 231 calls to justice and to support safety and justice for Indigenous in Ottawa. This concludes my verbal report. I would be happy to take any questions. Seeing none, is this received? Great, thank you. So we'll move on to item 7.2, Medical Officer of Health Verbal Report.
Thank you, Chair. Good evening, Kwe, Unusakut, Tanshi, Ani, bonjour. I know that many residents across Ottawa right now, particularly those living near the Ottawa River, are concerned about higher water levels and the risk of flooding due to rainfall and snowmelt. I wanted to mention that the City of Ottawa is actively monitoring the situation. Ottawa Public Health continues to work in collaboration with other city departments to ensure residents have access to timely information to support their health and safety. OPH is encouraging residents to stay informed about flood risks, including how to prepare for flooding and staying safe during and after a flood. Information can be found on the City of Ottawa's website and through social media channels. I'd like to begin my prepared remarks by recognizing two recent leadership appointments within the public health community. I extend my congratulations to Canada's new Chief Public Health Officer, Dr. Joss Reimer, on her appointment, and to Dr. Kieran Moore on his reappointment as Ontario's Chief Medical Officer of Health. Both roles are critical to advancing public health practice across jurisdictions, and I very much look forward to continued collaboration with them and their teams. Earlier this month, medical officers of health from across Ontario gathered in Toronto to meet, hosted by Dr. Kieran Moore. And this meeting provided an important opportunity to connect, share perspectives, and discuss priorities for the coming years. Ces échanges nous ont aidés à mieux comprendre les enjeux pour planifier l'avenir de la santé publique en Ontario. Ils guideront aussi notre travail à Ottawa alors que nous travaillons avec le conseil de santé et notre personnel à l'élaboration du prochain plan stratégique de santé publique Ottawa. I would also like to acknowledge a recent system change related to consumption treatment service and supervised consumption service sites in Ottawa, consistent with the update that was previously shared with the board and members of City Council. As many of you are now aware, the province of Ontario has announced it will suspend funding for CTS and SCS sites within communities supported by a homelessness and addiction recovery treatment or heart hubs. In Ottawa, this affects the two remaining CTSs, which are Ottawa Inner City Health Site at the Shepherds of Good Hope and the Sandy Hill Community Health Centre site. Ottawa Public Health does not operate or oversee these sites, nor do we have the authority to fund their operations. Our role remains focused on monitoring community health, issuing overdose alerts when required, convening partners through the Overdose Prevention and Response Task Force, and continuing to deliver harm reduction and clinical services through OPH programs and outreach. This work is challenging and complex and deeply important in our community. I want to thank OPH staff for their professionalism, compassion, and continued commitment to reducing harm and supporting community well-being during this period of transition. Je tiens aussi à reconnaître les effets de ces changements sur le personnel et les partenaires, surtout ceux qui travaillent directement avec les personnes qui consomment des drogues et ceux qui aident à la coordination des services. I've met with the mayor, members of the city's senior leadership team, and the chief paramedic to provide guidance on how we as city leaders can support the community and health partners to manage this transition and help mitigate impacts over the coming months. Chair Kitts and I also recently heard directly from community leaders in Sandy Hill and Lower Town alongside the local councillor to better understand their concerns and to explore how OPH can support these communities and work collaboratively moving forward. We have heard from these partners and community members about their concerns regarding the potential loss of funding for these services and the gaps that this will create. These concerns include increased public drug use, a rise in discarded drug use equipment, and higher overdose rates, which would place additional pressure on first responders. Santé publique Ottawa continuera de travailler avec les partenaires communautaires et de la santé pour suivre la situation, coordonner les services et répondre aux besoins de la population. I'd also like to take a moment this evening to recognize that April is Oral Health Month. Oral health is a fundamental component of overall health and an important part of public health practice. It supports nutrition, communication, confidence, and infection prevention, and plays a critical role in children's growth, development, and readiness to learn. At the population level, oral health promotion and disease prevention are essential to reducing avoidable illness and supporting lifelong health. Later in the meeting, our dental program team will share a video highlighting Ottawa Public Health's oral health program. Through this work, OPH contributes to a comprehensive approach to health by focusing on prevention and early intervention, supporting children and families across the city, and helping to reduce downstream health impacts. Je tiens à remercier notre équipe de santé bucco-dentaire pour son travail continu. J'encourage tout le monde à profiter de ce mois pour réfléchir à l'importance de la santé bucco-dentaire, non seulement en avril, mais toute l'année. Before concluding, I would also like to recognize National Nursing Week, which will be celebrated from May 11th to May 17th of this year. National Nursing Week is an important opportunity to recognize the dedication, skill, and compassion of nurses across the health system. I'm continually impressed by the commitment and professionalism of the nurses at Ottawa Public Health, and I'm grateful for their contributions to protecting and improving the health and well-being of Ottawa residents. Their work across health protection and promotion through clinical care, prevention, outreach, and emergency response is essential to the functioning of our public health system. And I encourage everyone to take time during the week to acknowledge and thank OPH nurses for the work they do every day. Or you don't have to wait for that week, you could do it anytime. But we do have an extra special presentation here to conclude today. I'm going to invite the Deputy Medical Officer of Health, Dr. Laura Borns, to provide the board with an update on the respiratory season, which is now thankfully coming to an end, and the related trends we've seen this year. Otherwise, that concludes my verbal report, and I'd be happy to take any questions after the presentation. Thanks.
Thank you very much. So as we shift into preparing for the summer season, we want to look back briefly to provide some highlights from the season's respiratory response and the impacts of the respiratory season locally here. So to begin here, I'd like to provide an overview of the respiratory virus activity that we saw this season. So here we have an overview of the influenza, COVID-19, and RSV percent positivity this season compared to last season. These types of graphs will probably look familiar to you, but just as a refresher, the percent positivity is the percentage of tests that are positive for a particular virus. The percent positivity is just one of the measures of respiratory virus activity that we look at and is included on our respiratory dashboard. In the graph here, you will see the solid lines show the percent positivity for each virus this season by week, and the dashed lines show the corresponding percent positivity last season, so you can get a comparison between seasons. The story of this respiratory season, which I think most of you will know, is influenza, which is shown in orange here. Influenza activity went up rapidly once the flu season began, with percent positivity peaking in December around the holiday period. This peak was about 2 months earlier than we saw last season, and the peak was higher than we had seen in recent seasons. This is likely due, at least in part, to the dominance of influenza A, H3 and 2 this year, and in particular subclade K. Patterns of flu activity were similar at the provincial and national level to what we saw here locally. COVID percent positivity is a good news story overall. Shown in dark blue, it peaked first in October before declining and peaking again in November. Overall, COVID-19 percent positivity was lower than last season and in the previous seasons. RSV percent positivity shown in green here peaked in January, a month later than we saw last season. While the peak was lower than the prior year, activity did continue into the early spring here. This season, we've seen a shift in the severity overall of respiratory illness, and overall, it has been a good news story with a few nuances. We've seen a continued downward shift in severity compared to the last 3 seasons, with an overall decrease in the number of respiratory outbreaks and a decrease in the number of hospitalizations overall. Much of this decline has been driven by decreases in COVID-19 activity this season and also COVID-19 severity. However, there were increases in flu activity, which drove increases in flu hospitalizations this year. The top graph shows outbreaks this season by week, with a total of 267 respiratory outbreaks in healthcare settings season to date so far, with outbreaks peaking in early January. The total number of respiratory outbreaks is down 27% this season compared to the same time last season, which is including an over 50% decrease in the number of COVID outbreaks. Season to date, there have been over 1,000 hospitalizations, specifically 1,161 hospitalizations in Ottawa due to influenza, RSV, or flu, which is a 29% decrease compared to the same time last season. True groups, though, that we know are particularly affected by respiratory illness and that we saw it affected this season again are young children and older adults. Here in the bottom graph, you'll see the number of new hospitalizations each week of the respiratory season compared to the previous 3 seasons. As you can see, the peak was in December, largely driven by hospitalizations from influenza. And we saw that there were 4 weeks when hospitalizations were above the average of previous seasons. However, you'll see overall that the number of hospitalizations has been below previous seasons' averages. Next, turning over to immunization. Immunization continues to be the best protection against severe outcomes from respiratory illness. Thank you to all those in our community who've gotten vaccinated and all those who helped provide immunizations this season. OPH's immunization clinics for COVID-19 and flu focused our services on those facing barriers to access in the community, including young children, newcomers without OHIP, rural pop-up clinics and wards not serviced by pharmacies. We also supported First Nations, Inuit, and Métis partners and high-priority congregate care settings. You'll see a few statistics here on the slide to provide a few highlights. For COVID-19 for the season to date, over 190,000 Ottawa residents, which is about 16% of the population, received a dose of COVID-19 since the start of the respiratory season. 45% of older adults received a dose. And overall, we see higher vaccination rates for COVID-19 in the older adult population. 86% of individuals were vaccinated at pharmacies, and OPH provided just over 5,000 doses. For influenza, overall numbers this season were similar to the previous season. OPH has administered over 5,700 doses so far this season, and over 150,000 doses of vaccine were distributed to community providers. And Ottawa pharmacies played a central role as well in immunization for flu, with over 250,000 doses being administered by pharmacies this season. For RSV, we've had some substantial growth of the RSV program in the province in the recent years. Ontario's RSV prevention program for infants and high-risk children continued this year, and the season's program ran until April 17th due to the ongoing RSV activity that ran into the spring. OPH distributed over 11,000 doses of RSV monoclonal antibody for this program, and 305 doses of RSV monoclonal antibody were administered through OPH's clinics in conjunction with Kids Come First for eligible infants not immunized in the hospital and enabled access through primary care. Lastly, for immunization programs, the highlight is for the RSV program for older adults. This program had a large expansion this year, expanding to include all residents 75 years of age and older. and OPH clinics were available and focused on those without access through primary care. Over 32,000 doses were distributed to external providers since the beginning of the season, and this allows residents to have access to vaccines through locations such as long-term care homes and retirement homes, hospitals, and community healthcare providers. OPH also offered adult RSV clinic days with booked appointments for older adults, in addition to offering to eligible individuals in congregate settings and First Nations and Inuit Métis pop-up clinics. The provincial program for older adults will be continuing throughout the year, as evidence indicates the protection provided by the vaccine is multi-year protection. And last but not least, I want to just highlight some of the communications for the respiratory season I think many of you will have seen. Our communication strategy was built on a phased approach directed by and responsive to local epidemiology, using surveillance data from our dashboard that keeps our community informed. And we adjusted our tactics throughout the season based on the epidemiology. Throughout the season, we leveraged a mix of media interviews, in French and English, public service announcements, social media, targeted advertising, multilingual handouts, and direct communications with elected officials and partners. This ensured residents received the information when they needed it. As well, our community engagement team and community hubs continue to play a critical role in reaching high-risk populations through outreach and trusted community partnerships. This approach overall was strengthened with ongoing collaboration with our neighboring health units and local hospitals, supporting consistent region-wide messaging and extending overall reach. So I'd like to thank you for your attention and also for all your efforts that you take to help protect our community and decrease the impacts of respiratory viruses locally. Thank you very much.
Wonderful. Thank you to you both. So we'll open it up now for questions if anyone has any. Member Bauer.
Thank you, Dr. Arneson, for your report. I just had a couple follow-up questions on the provincial announcement on funding cutbacks to CTS sites in Ottawa. I came across a study recently by the Canadian Drug Policy Coalition that was undertaken since the last round of closures in March 2025. Shows a 20% increase in opioid toxicity deaths. EMS calls related to opioid toxicities increased on average 70% in the affected cities, and emergency department use was up 67% on average. We had Ottawa Inner City Health ED Rob Boyd here recently presenting to the board. Just an incredible number of visits to the trailer alone in terms of weekly drop-ins, 800 to 1,000 visits weekly. And these are some of the most vulnerable residents of our city. So quite a concerning context as we move forward into the summer to try and mitigate these the impacts of these announcements. And I very much appreciate the memo to the board that you sent and the mitigation measures that you're putting in place. A couple questions. Do we have any sense of a possibility for services to consider to continue at both of these sites from or based upon other funding sources? And my second question is, given our convener role, you mentioned, discussions with community partners. I know one lever that OPH has itself is our mobile outreach units. I'm just wondering if we are considering expanding services through those teams, and if we've bringing forward any lessons learned from the closure of the Somerset West Community Health Center in this regard.
Thanks very much for the questions. All very good points that you've raised. I think to answer the first question, so the announcement is a cessation of funding. So these sites, the two sites that are closing, we're receiving close to $4 million in provincial funding to operate their services. They do a range of services. I think it's difficult to describe it solely as consumption treatment services. They're also serving people in the vicinity of their locations who may be overdosing outdoors. We've seen an increase in smoking being the root of of people using drugs. They've had to increasingly respond to the needs in the surrounding community. Technically, there's no law here prohibiting them from continuing to operate as was the case when Somerset West Community Health Center closed, and when we ceased operations at our site on Clarence that was brought to the board. That was because we were not granted permission to renew our exemption for supervised consumption services through the federal Health Canada that regulates drugs. So we weren't allowed to have drugs on site, which is a prerequisite for our operating consumption treatment service. Those are independent organizations, Sandy Hill and Inner City Health, that may look at other ways to fund their services. But I think the bottom line from speaking to them is that this is a large amount of money that cannot be easily or readily replaced. And in terms of their other services, they will not be able to keep up in terms of the demand is quite explicitly because the services of consumption treatment are not allowed are not permitted anywhere in Ottawa after these sites close. So they have told us that they feel that there's individuals who, as much as the Heart Hubs, the newly established homeless addiction and recovery treatment hubs are a good resource for people, they still have large numbers of people who are not going to avail themselves of those services, and so there's a gap for individuals. And the big concern for me, as you highlighted, is we're coming up in the summer months where we do see more people out in the community, and in those areas we're likely going to see more individuals who are looking for services that they can't get, including a location where they used to have the health service of the consumption treatment site. So you highlighted my biggest concerns basically about the paramedic calls, I think are going to go up. ED visits may go up fairly quickly. I think what we've seen in other jurisdictions and what we saw with the Somerset West Community Health Center closure, it's not necessarily an observable increase in overdose deaths or overdoses in the short term, but these are longer term outcomes that we're worried about. And I think the community, as Rob Boyd has said, often will find ways to mitigate and support others, and they may be looking at other ways to use their services as they can to support people, which they always do. So there may be a mix of those mitigations that are going to make the overdose numbers, which are at the best of times difficult to attribute to any individual public health action because of the toxicity of the drug supply changing, and we don't have a lot of information on that, make it hard to attribute certain overdose deaths to these closures. But nevertheless, I think we as a community are going to experience concerning, levels of requests for paramedic calls and other things. In terms of the other, we're talking with the overdose prevention and response task force. We've met and looking at different ways that every organization, including the paramedics, can plan and mitigate as best we can. But I think and we as Ottawa Public Health, when we ceased our on-site location, we increased some of our outreach through the site van, as you mentioned, that mostly for naloxone, which is the reversal agent. But I think this time, is is a pretty significant event that those are not going to be sufficient. And I think the purpose of talking about it today too is, we're starting to try to increase awareness in the community that this is going to be a challenging summer.
Very much appreciate those answers. And I think as we move into the summer, I know we would appreciate updates on the response from OPH in the community. So thank you.
Yeah, we are also communicating a bit more broadly. So we'll share after meeting with the mayor's office. We've discussed, the need for increased communication and awareness about what's going on. And so, yeah, we'll keep you posted on those updates as well.
Great. Thank you, Member Bauer. Member Carr.
Thank you very much. I just have a question. I know I do take a look at the dashboard on occasion, but have we seen an uptick in overdoses since the cessation of the Somerset West site at all? Has there been any market change in statistics that you've seen?
So, I caution a lot about attributing any individual site because, well, it's the actual main issue is that if you look at the data, many of these different places, the toxicity of the drug supply is really a really big factor. And so, and we have very little information around that because we are not, the drugs that are being used are not produced legally for the most part. So we don't know why certain elements are so toxic. And I mean, that was the real, I mean, we've had people using drugs for many, many years, but the real crisis is that the drugs became heavily contaminated with fentanyl, essentially. So it's a fentanyl crisis in many ways. And the toxicity of the fentanyl can increase or decrease at any time. We're seeing a lot of new additive stimulants. There's a new veterinary tranquilizer that has contaminated the supply called medetomidine. And we've spoken to the police about this as well. And, I think everyone's sort of saying there's a lack of information around the drug supply, and there's efforts underway nationally and through the federal government to try to get a better handle on those things. But that makes it really hard to isolate any specific closure to an increase in overdose deaths. And unfortunately, many people have pointed to the lack of change, immediately after certain specific closures as being evidence that the sites weren't working. But I think that's a fundamental misunderstanding of the issue, which is that we need multiple harm reduction approaches for different people and where they're at. And so I think the one thing that we're going to be monitoring closely that I think, as mentioned by Member Bauer about studies is I've seen fairly consistent evidence that emergency department visits and especially paramedic or emergency responder calls go up in these situations. The other thing I'll say is that Rob Boyd from Inner City Health has, working with this population has pointed out to me in the past is that we also don't know after these closures what the mitigating factors are sometimes that the community mobilizes that may actually reduce the overdose deaths as well. So that's also another unknown is these sites have been dealing with individuals who are using through smoking and responding outdoors, and it has evolved. So they may continue to do that, and so some of the worst impacts may not be obvious in the short term.
Okay, thanks very much. I just have a slight follow-up.
Sure.
We haven't yet in Ottawa, I don't believe, had a significant evidence that we've had, for example, carfentanil in the drugs, such as happened in Edmonton, and there was a high rate of overdoses and deaths. How is there tracking of, is it just from the safe consumption sites that they track that we get statistics on how poisoned the drugs are? Where is the bulk of that information coming from? The testing machines? So
that's a very good question. So historically, that information comes from testing the drugs. So that involves, and it's an important point actually that I forgot to make, which is that that also depends on having the exemption from the federal government through Health Canada for drug checking. Now, we've asked, because these sites are closing, they will not be allowed to do drug checking on site anymore. So we've asked, is there a separate process? And there is a separate process where you can apply to get drug checking. There's a number of medical officers health across Canada and namely in Ontario that are looking at coordinating better around this information, especially through Toronto and their drug checking services through Toronto and maintaining those. So we're in active discussions about how we can maintain some of that, and perhaps we can coordinate. My suspicion is that, not being a police officer, but my suspicion is that much of the drugs that we see in Ottawa are not that different than what we see in Toronto and Montreal. But there are a lot of questions around the drug supply, as I mentioned. And we've also been in discussions with Health Canada and researcher in Alberta who has started looking at wastewater as a potential way to test. But the challenge with that is it's very much early in the research phase. It's not yet in the let's employ that for surveillance like we have for the drug checking services. But given the circumstances and the lack of information, it's certainly something that we as a public health field want to pursue in terms of supporting the research and looking at it as a potential tool to help get more information about that.
Okay, thank you.
Thanks very much, Member Carr. Member Grunwald.
Thank you. This might be more of an observation than a question, but just thinking of the lack of resource which is going to be available in the community thanks to the closure of these two centers at the same time as we're seeing still very high occupancy of emergency departments, long wait times in our community hospitals and our academic centers across the city. And then you mentioned just around the paramedic calls, again, a notoriously high volume service in the city, and just thinking, what are the options? Is there an opportunity for collective action with the hospitals and Ottawa Public Health? Thinking about communications with the province or anything else, because that just seems like the perfect storm of reality for these vulnerable patients.
Yeah, so I mean, the overdose response task force is a collective where we meet to discuss these things, and our role as public health is largely as the convener and the coordinator of those partners. I will say, the Ottawa Hospital is an active partner with Inner City Health. They have longstanding connections and work together and are very aware and concerned. So we've raised that concern, or what I basically just said around my concerns about the emergency department and response increases. So the hospitals are aware. They're concerned. The role of public health has been to coordinate that group for ideas for collective action, and also surveillance and monitoring has been a big part of our role. But in terms of the coordinating on the health system response, that the healthcare system is managed through Ontario Health, the provincial health authority. They're aware of this change, and they are administering the process for wind down plans for the two sites and all the other sites across Ontario that are no longer receiving funding. And they have put in place some requirements for the sites in terms of the planning, which is supposed to allow for some cross-system planning for the healthcare system. I think a lot of the planning does rely on the does rely on the assumption that many of the individuals can be referred to the nearest heart hub or nearest heart hub location. And we do have 2 heart hub locations in Ottawa, one at Somerset West and one at Pinecrest Queensway has opened in Bell's Corners. The challenge is the concentration of or the location of the 2 sites has been in Lower Town, Sandy Hill area, and the services in those other sites are not immediately available to those individuals. Over time, as we build more systems for people to be directed to those sites, I think it will improve. But I think the concern right now is that we're going to have a number of people predominantly in that area where the 2 sites are closing that aren't really sure where to go and are going to have a gap in service because they're not really seeking the services that are available at a heart hub right now. And I'm just hearing as well, we're like all of the hospital partners, it's not just TOH, all the hospital partners are part of the task force, all of the hospitals we have in Ottawa, including the MOFOR and Queensway Carleton.
Great. Thanks, everyone. I'm not seeing any other questions. So is this item received?
Received.
Great. Thanks again. So item 7.3, update on Ottawa Public Health Dental Health Services Program. We are going to have a presentation. So I'll invite Marzouk and anyone else who wants to come up.
Thank you, Chair. And thank you, Dr. Arnason and members of the board for the opportunity to be with you today. With me, I have Noel Taraf, who is the Dental Program Evaluation Officer. And then on my right, there's Kelly Bix, who is the epidemiologist who helped us with this report. As this meeting takes place during the Oral Health Month, we wanted to complement the report with a short video that brings the work of the Ottawa Public Health Dental Services to life. Rather than focusing on numbers or operations, this video follows the client journey. From that very first call for help through clinic care and in schools and community settings to illustrate how our teams work together to deliver equitable and client-centered care. We'll be happy to take any questions or comments following the video.
Every day, people across our city reach out for dental care. Sometimes because of pain. Sometimes because of concern for their child. And sometimes simply because they want to stay healthy. No matter who they are or where they live, help is within reach.
À Ottawa, 5 cliniques dentaires travaillent ensemble dans le cadre d'un programme de santé publique coordonné, veillant à ce que les personnes et les familles reçoivent les soins dont elles ont besoin au moment et à l'endroit où elles en ont besoin.
Every journey begins with a phone call.
Ottawa Public Health Dental Services, how can I help you?
It might be a worried parent, a senior living with discomfort, a newcomer unsure where to turn. Each month, Ottawa Public Health's Dental Contact Center manages more than 1,200 calls, serving as the first point of connection for people seeking care.
L'équipe du centre d'appel écoute attentivement, répond aux questions, confirme l'admissibilité et prend des rendez-vous. Plus important encore, il rassure les clientes et les clients en leur faisant savoir qu'ils ne sont pas seuls et qu'ils recevront l'aide dont ils ont besoin.
From that very first conversation, clients feel heard, supported, and welcomed into care. On the day of the appointment, the journey continues at one of our clinics. As clients walk through the door, they are greeted by our reception teams, the welcoming faces who help put people at ease. Reception staff ensure records are ready, paperwork is complete, and families know what to expect. Their warmth and organization set the tone for the entire visit, helping clients feel comfortable and respected from the moment they arrive. Behind the scenes, dental assistants are already at work. They prepare treatment rooms, organize instruments, take x-rays, and ensure that all equipment is properly cleaned and sterilized. Their role is essential to both safety and flow, and for clients who feel anxious, their calm presence and reassurance can make all the difference. Dental assistants help ensure that every visit runs smoothly, efficiently, and safely.
Les clients rencontrent ensuite le dentiste. C'est à ce moment que les questions trouvent leurs réponses et les préoccupations se transforment en soins. Les dentistes procèdent à des évaluations complètes, examinent les antécédents médicaux, interprètent les radiographies et administrent un traitement sûr et approprié, adapté aux besoins de chaque client. Pour plusieurs, ces soins permettent de retrouver le confort, la confiance, la capacité de manger, de parler et de sourire sans douleur.
But not all care happens within clinic walls. Ottawa Public Health's dental program extends into schools and communities across the city. Through school screening programs, children are assessed early, helping identify concerns before they become serious issues. Beyond schools, dental teams bring oral health services directly into shelters, community centers, newcomer programs, neighborhood hubs, and wellness spaces. By meeting people where they are, we reduce barriers related to cost, transportation, and access, providing screenings, fluoride treatments, oral health education, and referrals. This outreach work ensures that everyone has a fair and equitable opportunity for a healthy smile. From the first phone call to the final appointment, the Ottawa Public Health Dental Program supports clients at every step of their journey. Each year, the program's impact continues to grow through the number of clients served, procedures completed, school screenings delivered, and outreach events held across the city. Across 5 clinics, in schools, and throughout the community, multidisciplinary teams work together to deliver compassionate, accessible, and client-centered dental care.
Ensemble, ces équipes forment un programme de santé dentaire complet, axé sur la communauté, qui reflète l'engagement de Santé publique Ottawa en faveur de l'équité, de la prévention et de l'accessibilité des soins. Le programme de santé dentaire accompagne les clients à chaque étape de leur parcours de soins, leur apportant soutien et réconfort depuis leur premier contact jusqu'à leur dernière visite.
Healthy smiles strengthen healthy communities, and we are proud to help build both.
Okay, wonderful. I love when you bring videos because it really illustrates the incredible work that's being done in the community. Thank you. So we'll open up for questions then, if anyone has any. Yep, go ahead, Vice Chair.
Thank you. The video is really compelling, and those are the most compliant kids that I've seen in dental offices. So good job. My question was actually in the report around the number of private practices that aren't taking Healthy Smiles children, and it is a team sport. So what is it that we can do alongside our private dental colleagues to make sure that there's access sort of across the city?
Thank you for the question. So the number of participating dentists to see the socially funded programs is not something new. We have been seeing this for years, but the gap is getting greater as the socially funded programs fees do not match the increase of the cost of living and the expenses in private offices that occur. That adds pressure to public health units who families rely on accessing to dental care. And for us, we've been with very extensive engagement with working with other public health units and how to advocate to be able to review those fees, but also locally and how we collaborate with the community partners, including private offices, to see how we can help, how we can support them to be able to accept more under the socially funded programs. But CDCP, Canadian Dental Care Plan, has helped many families because to be able to see them under those plans, but those who are not eligible or cannot pay out-of-pocket expenses rely on Ottawa Public Health Dental Clinics as a safety net provider.
Thank you very much. Member Bauer.
Thank you, Chair, and thanks very much for the very comprehensive brief. Very impressive outreach efforts across the city. I was trying to understand the delta between the introduction of the CDCP, the new federal program, in terms of the impact on our 5 dental health clinics and related outreach services. In the report, I think you identified there were 168,000 individuals in Ottawa that were eligible for the CDCP. And you noted that there was an uptick in children accessing our health clinics, but it seemed the adult populations there was a decrease in visits. So are they, as a result of the CDCP, diverting now to private clinics? I didn't quite understand what we're seeing in terms of the impact on our clinics with the federal program.
Thank you for the question. The introduction of the Canadian Dental Care Plan has made a positive impact overall on expanding access to dental care and reducing barriers to many residents. It's a complement for other socially funded programs, including the one for children, provincially named as the Healthy Smiles Ontario, but also for the adults. The adults before the Canadian Dental Care Plan, there was no other plan that could help them access the dental care, especially the preventative services. We saw that uptake in the private offices, but in our dental clinics, we continue to primarily serve individuals who face those barriers when they cannot find a private dental office who accept any program they're in. So we see, as an overall, the Canadian Dental Care Plan as a complementing the existing programs. It helps reduce some certain barriers, including the financial barriers, but many still not eligible or cannot pay out of pocket when they seek care in the private offices. Come back to the estimates. These are estimates. I will look into my EP colleague to confirm the estimates. There was just estimates because the Canadian Dental Care Plan, you have to apply every year. And there are some eligibility that varies over time. And I don't know if you want to add some comments about
Happy to add more comments on the estimates, but they are just estimates. And honestly, they're a little bit old estimates based on dental insurance coverage. So that's something we don't gather every single year. So it's slightly out of date for that. And also with the income requirements for CDCP, but also the other programs, they aren't perfect matches for the data that we receive from community health survey and things like that. So it's not a perfect match for income requirements. So that's why it's an estimate. But we do know that you need to have filed your taxes and have proof of your income for eligibility in many of these programs. So that is something that we weren't able to take into account. So that's something that will dramatically change over time, especially with the programs.
Great, thank you.
Great, thank you very much. Member King.
Thank you, Chair. And I'd really like to firstly commend the staff on the work on the dental health services program. I know that we received tours of the renovated facilities on Merivale Road as well as on Coburg Street, and very impressed with the work that's been undertaken to ensure that the infrastructure is in place to provide the services. And also, I wanted to just comment that I'm always impressed with outreach around dental services by OPH, whether that ironically is at Halloween, even here at City Hall, when the mayor holds his Halloween event, and we see staff giving out toothbrushes, which I think is apropos for that for that time, to different events, especially in the Indigenous community and other communities for diverse communities. I think that that outreach work is really excellent. But I wanted to speak to that equity point. I know that the report states that OPH has begun collecting socio-demographic data from dental clinic clients. I'm just wondering what data has been collected so far, and has it revealed any specific gaps in access for particular populations that are not yet addressed in service planning?
Thank you very much for the question, Member King, and the comments as well. Um, the collection of social demographic data, we started early this year, and we have some early trends. I'm not sure if we have enough data to share, but from the overall equity lens, we have been kind of seen a lot the community voice that we've been working with the community engagement team. We've been hearing from the community themselves what are the gaps they're facing, especially go back to link it to the question earlier about the different programs and how to apply what program covers where I can go. That's how we developed supports. Our multilingual contact center is able to support those clients. But from the social demographic data we've been gathered so far, we think we had only 1 month data collection. But do we remember the number of kind of we had? Yeah. Can you go ahead? Thank you.
Yeah, so we've been collecting sociodemographic data since the beginning of March in our dental clinics. So there's a large volume of people attending all these dental clinics all the time, and we have about 20% of people filling in the SDD so far. So very, very early times, and we are collecting a bunch of different variables, including sex, age, also the dental insurance program that they're part of. So things like Healthy Smiles Ontario, if they're accessing that, or CDCP, for example. We're also collecting data on income and racial identity, and probably more primary care attachment. That's all that I can think of off the top of my head, but a large number of variables, and we're hoping to get enough data to start our kind of internal look by the end of June. So that's what we're estimating. We'll have something that we can start looking at. But one of the big things is the language, and we already have a large number of staff with a variety of different languages. So that's one of the primary focuses, and we'll look at the language that people speak as well.
Well, I appreciate it's early days, but I think it's the right approach, and I'm really pleased that that data is being collected so other decisions can be made in the future. I did have a follow-on question, I suppose, about access and just reimbursement, so around financing of these programs. I'm wondering if OPH has engaged with the Ministry of Health specifically on the Healthy Smiles Ontario reimbursement rate issue. And if so, what has been the response? And is there a formal advocacy position the board could endorse?
Thank you, Member Kick, for the question. As I was mentioned earlier, it's been a challenge for decades. Many public health units have been working together. We have frequent meetings with the Ministry of Health about the challenges that we face locally. Dental associations as well, whether locally or provincially, have been very vocal about the gap that exists in the communities. And so far, we haven't received a formal answer or communication from the ministry about that.
Well, I appreciate those comments and observations. Obviously, the program is very important. We know that, in order for people to have better health conditions generally, we have to attend to oral health. And I think we're doing as much as we can as a municipality. So I really commend you for the work that's being undertaken. And as well, like I said, really impressed with the investments in infrastructure to improve service delivery. Thank you, Chair.
Thank you very much, everyone, for your great questions. I've had the opportunity to visit a couple of our dental clinics to see the great work that you're doing, including the new one in Orleans, where there was a significant transformation. So thanks for being here today, and thanks for the great work. Is this item received? Great. Thank you, everyone. Okay. On to item 7.4, Ottawa Public Health 2025 Annual Report. We are going to have a presentation, and then we do have a delegation, and then we will go to staff questions after that. But before I hand it over to Dr. Arneson, I wanted to offer just a few reflections on the work of this board and Ottawa Public Health over the last 4 years. So as you are all aware, this will be the final annual report considered by this board. When we received our first annual report, many COVID protocols were still in place, and OPH was beginning its transition from an emergency pandemic response back to more typical operations. During that time, the organization moved from thousands of employees to approximately 500 in a very short period. That was a massive undertaking and one that required exceptional leadership, both from the OPH staff and from those around this table. Much of the work of this board has undertaken over the last 4 years reflects a period in which the role and priorities of public health shifted significantly in the post-COVID context. Chaque année, lorsque je lis ces rapports annuels, y compris celui qui nous est présenté ce soir, je me rappelle l'impact que l'OPH a dans tous les quartiers de notre ville. This report in particular reflects the results of our strategic plan in action. OPH working collaboratively with the community to promote and protect the health and well-being of all people in Ottawa. It affirms our shared vision where all people and places in Ottawa are healthy and thriving, and highlights OPH's commitment to being equity-driven, prevention-focused, and focused on maximizing impact. Je tiens à remercier chacun d'entre vous pour votre soutien, vos conseils et votre leadership. Le travail accompli par ce conseil se reflète dans ce rapport annuel. So congratulations to you all. I also wanted to extend my sincere thanks to the dedicated staff of OPH for their incredible work in fostering and protecting the health of our community. So with that, I will hand it over to Dr. Arneson.
Thank you. Today, I am so pleased to present to you the summary of the Ottawa Public Health 2025 Annual Report. While this is only a snapshot of the accomplishments that the phenomenal staff that I get to work with have been able to achieve, I hope this provides some insight into the valuable but sometimes hidden work that Ottawa Public Health does that has such an important impact on our community. I'm going to be signaling when to move along in the slides, so we'll go to the next one. Chaque jour, l'équipe de SPO s'efforce de garantir aux habitantes et habitants de tous les quartiers d'Ottawa l'accès à des services et programmes de santé publique essentiels qui préviennent les maladies et favorisent un mode de vie sain. I believe I covered this slide, but actually, no, sorry, staying on this slide. In 2025, we advanced several important priorities, including bridging public health services such as immunization, dental screening, and healthy growth and development programming closer to communities. In addition to this, our work with community partners has helped to strengthen our capacity to provide preventative health measures, avoiding health problems before they happen. Now it's time to switch the slide, please. Next slide, slide 3. While not all the impacts that OPH has provided can be measured, we are pleased to showcase the tens of thousands of interventions, both on the front lines and the behind-the-scenes work in our communications and epidemiology teams, for example, that have kept Ottawa a place to live well and thrive. Slide 4. Preventing diseases like measles through vaccination continue to be a cornerstone of OPH's work. Tout au long de l'année, SPO a souligné l'importance des vaccinations de routine, en particulier à l'approche de la rentrée scolaire. Surveillance efforts reviewing school-aged children's records led to substantial improvements in compliance, reducing gaps in immunization coverage among 7 and 17-year-olds. OPH also supported families who faced barriers to accessing vaccines, administering thousands of routine childhood immunizations, including measles-containing vaccines. In partnership with community organizations, such as through the Kids Come First health team and the OPH's partnerships in the neighborhood health and wellness hubs. Next slide, please. Another major achievement in 2025 was that our neighborhood health and wellness hubs continue to be widely accessed by Ottawa residents. Ces centres ont fourni des services de santé et des services sociaux gratuits et accessibles sans rendez-vous en collaboration avec la ville et des partenaires communautaires. These hubs offer vaccination services, dental screenings, parenting support, employment and social services supports, and other public health resources for residents facing systemic barriers to care. These hubs, located in low-income neighborhoods, also serve as key access points for children and youth requiring routine or school-based vaccines, including those without a primary care provider or OHIP. Next slide. In 2025, OPH strengthened community-wide suicide prevention efforts through training, early intervention, coordination, and collaboration across health and social services sector, such as leading the Suicide Prevention Ottawa Network. Further, OPH continued to coordinate the Overdose Prevention and Response Task Force, made up of 45 plus partners working together to advance Ottawa's overdose prevention and response strategy, and expanded the community naloxone partnerships, which now totals over 40 plus health, social service, and community partners. To enhance prevention, OPH expanded the Party Safer initiative, which is now included in the city's special events bylaw. Next slide. In 2025, the Sexual Health Services had over 6,000 visits, with approximately 93% of clients belonging to equity-denied groups. To further increase accessibility to sexually transmitted and bloodborne infection treatment, the Sexual Health Services team runs the STI Med program. The program provides primary care providers in the community with publicly funded medications to treat their patients for STBBIs at no cost to the patients. The SHS Sexual Health Services also offers STBBI testing via Get a Kit, which is an online service. Next slide. Other programs at OPH have also taken novel approaches to reach clients in need. In 2025, the Healthy Growth and Development Program successfully integrated its 9-week group-based cognitive behavioral therapy program as a core service. The program is offered to women who are pregnant or parenting a child up to 18 months and experiencing symptoms of depression, anxiety, worry, anger, or of being overwhelmed. During the year, the program was expanded to serve French-speaking clients and fathers as well. Next slide. As we just heard earlier in our board meeting, 2025 marked a pivotal year in OPH's work to advance equitable, accessible oral health care for residents of all ages, especially Ottawa's growing senior population, through expanded clinics, strengthened partnerships, and continued advocacy for sustainable funding. Cette année a marqué l'achèvement de la toute nouvelle clinique dentaire de SPO. Le nombre d'inscriptions au programme ontarien de soins dentaires pour les années à Ottawa est passé d'environ 2500 en 2020 à 11 000 en 2024. Et la demande des services destinés aux personnes âgées continue de croître rapidement. I'd also like to add that the oral health month and presentation we had today were excellent, highlighting the importance of oral health. Sometimes we forget about the importance of all the work we do on oral health, and I thank the team for coming today to talk about that as being such an important intervention for public health. Next slide. OPH receives funding from both provincial ministries and the municipality. It is important to note that the total provincial funding reported in our annual report reflects contributions from all provincial ministries, not solely the Ministry of Health. As we have highlighted throughout this term, there continues to be a significant funding gap between the level of funding committed by the Ministry of Health for public health units and the amount OPH is receiving. At the June meeting of the Board of Health, we will be bringing forward a financial stability plan along with options to address the current financial situation and outlook. And last but not least, slide 11, looking ahead to 2026 and beyond, we are emphasizing the importance of building strong, enduring partnerships with our public, community, and health partners as we enter the final year of the Ottawa Public Health Strategic Plan, the strategic plan that this board has developed and shepherded through. I want to sincerely thank my colleagues at OPH as well as the Board of Health members for their guidance and thoughtful insights in confronting the public health challenges we've faced over this last year, and for recognizing our significant organizational accomplishments and the value of the work we do every day. Thank you. Merci. Miigwech.
Thank you, Dr. Arneson. So we have one delegation, so I'll invite James Scott McKillop to come forward. Good evening, James. You have 5 minutes.
Good evening. Exploring the next frontier of medicine using AI in Ottawa public health. Everything I'm sharing today is part of the biodigital convergence, also known as the Nano Bio Info Cogno experiment. Nano for nanotech, bio for biotech, info for IT, including advanced computing, cogno for cognitive science, and neuroscience. Meet Jean-Francois Dion, geospatial strategist of the City of Ottawa, and Randall Roger, program manager at Speed's Geospatial Analytics Tech and Solutions. Randall, Roger, and Jean-Francois Dion are building Ottawa's digital twin, want to collaborate as much as possible with Ottawa Public Health. Canadian Institute for Advanced Research, SciFar, Law and Ethics, and Health-Related AI Digital Twins refers to a combination of tech, including AI, predictive analytics, augmented reality, and the IoT to create virtual replicas of physical entities, including humans and organs. CFAR releases U of O reports on AI in healthcare. AI will transform our healthcare system. AI is already being used to track patient data, triage care, scan medical image, diagnose diseases, and make treatment decisions. AI is even predicted to substitute human caregivers and medical service providers. The Pan-Canadian AI for Health, the guiding principles as part of the working together to improve health for Canadians, health ministers endorse a joint FPT action plan, health data and digital health, and a Pan-Canadian health data charter to guide the path forward. Meet Jeffrey Hinton, godfather of AI and artificial neural networks and recent doomsdayer who believes AI will bring about the end of people. Crystal Vanderels, Director General Policy, Horizon CEO of the Global Foresight Group and former head of strategic foresight at the World Economic Forum. Policy Horizons, exploring biodigital convergence, gene sequencing combined with AI leads to understanding genetic expression. CRISPR and other gene editing tech would have been impossible without digital tech and bioinformatics. There's also a feeling of the field of biological computing, neural nets, computer-based on biological brains. Policy Horizons Biodigital Today and Tomorrow. COVID has accelerated research in various biodigital innovations from mRNA vaccines to alternative immunization methods like nasal sprays to biosurveillance sensors, genomic therapies, and for increased understanding of the human microbiome. Policy Horizons. This has also accelerated telemedicine and health apps and prompt discussions about biosurveillance. Co-evolution of biological and digital entities include advancements in understanding how brains work using neural networks and AI. Tracking human health in real time using wearables that can monitor health for more data. AI can track moods, mental health by analyzing voices and facial expressions. Machine learning could process data in the cloud, automatically collected from nanosensors and implants inside the human body. AI is also allowing leaps in research sciences, including the synthesis of new biomaterials. Foresight and AI, neurotech, refers to tech that provides insights into the activity of the brain. Example, AI trained on brainwaves to reconstruct text, images, and audio based on what a person is thinking. Neural networks will lead to improvements in detecting emotions and moods, which may have safety and security applications. Neural network image recognition is programmed to algorithmically determine the content of a given image. This also gets into emotion tracking using sensors, computer vision algorithms to identify emotions, and predictive group sentiment analysis. Neural network computers are also used for predictive crime prevention, like Minority Report. Neural interfaces include EEG brain-to-computer interfaces, high-resolution fMRI, optogenetic implants, and brain-to-brain interfaces Francois Collet, a member of the IEC and ISO and SCC. He's responsible for international standards surrounding IoT digital twins and biodigital convergence. This includes smart healthcare. Some international standards from IEC surrounding digital twins. This includes human digital twins for medical research. IEC also standardized the industrial metaverse, sees great potential for healthcare industry with various applications. In the medical field, the metaverse is enhancing design, testing, of medical devices. Training professionals, VR and AR and digital twins is transforming healthcare. Canada is pursuing a moonshot program with several international funding models to support this research, including
that is your time.
I would like to end this with I'll end my presentation with a quote from Camus. The welfare of the people in particular has always been the alibi of tyrants. It provides further advantage of giving the servants of tyranny a good conscience.
Great. Thank you very much. Do we have any questions for James? I'm not seeing any. Thank you very much for being here this evening. Thanks. Okay, so we will go back to questions on the presentation. Member Carr.
Hi, Dr. Arneson, I have a very specific question. You mentioned the health hubs in your presentation. I had a health hub at Heron Road Community Center until they took it away when it shut down for a shelter. The community center has now been reopened since August. Do you know if they are going to reopen the health hub in that location?
Yeah, so I think the health hub locations has been probably the most challenging thing about the neighborhood health and wellness hubs because when they were first opened, it was a very different time. At that time, there were many closures of facilities due to the pandemic, and the choice of locations was largely based on information that we had about health equity and equity denied groups relating to COVID vaccination and other COVID prevention measures. So that's how sites were selected, along with the practical considerations of location, along with where they were located. Some of them are with community partners, some of them are with outside organizations such as churches and so on. We continue to review the site locations. We continue to review where they're located, but also the agreements that we have are often being initiated for change by the partner. So for example, a community center may indicate that they can't provide the space that we've been looking for or that we had previously because of programming that they've added. So we're continuing to look at the different spaces, but there's no immediate plan or specific plan to place an additional location at that community center at this time.
Okay, thank you.
Thank you, Member Carr. I'm not seeing any other hands up. So is this item received? Great. Thanks, everyone. So item 8, information previously distributed. We have Ottawa Public Health Research Projects 2025. We have no longer any in-camera items. Motion to adopt reports, Member Carr.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Update on Ottawa Public Health's Dental Health Services Program, Ottawa Public Health 2025 Annual Report, Delegation of Authority, Contracts awarded for the period of July 1st to December 31st, 2025, 2025 Operating Capital Year End Results, Board of Health for the City of Ottawa Health Unit Status Report, and Performance Appraisal of Medical Officer of Health in-camera personal matters about an identifiable individual, reporting out date not to be reported out, be received and adopted.
Is that carried? Great, thank you. We have no motions of which notice have previously been given. We do have a motion requiring suspension of the rules of procedure, so I'm just going to explain that a little bit so it doesn't happen that often at this board. So Member Gower is going to introduce a motion which has, which he'll explain there's a time sensitivity to it, and then with the board's approval, we can then consider that item right away. So we can carry it and it'll become an item on the agenda, or if anyone wants to vote on it, we can do that too. But I'll turn it over to Councillor Gower to introduce.
Yes, given that this is a matter of urgency, I'm seeking the board's support to waive section 53(4) of the procedure bylaw so that this can be heard today. Do you want me to introduce the motion?
Is that carried by the board? Are we okay to hear it today? Okay, great. Thank you.
Okay, so I'll read it in. And I'm introducing this on behalf of Councillor Kathy Curry, who's not a member of the board, but she asked me to raise this on her behalf. Whereas the former Canada Lakes Golf and Country Club site at 7000 Campo Drive has documented legacy contamination, including mercury associated with decades of golf course pesticide and fungicide use, whereas active site work, including significant soil disturbance, has commenced on the property, whereas recent rainfall has resulted in large areas of standing water on the site with no approved stormwater management solution currently in place, whereas residents have reported potential impacts associated with ongoing site activity, including wildlife illness and mortality observed on site, structural vibration and cracking in nearby homes, and localized infrastructure impacts, including movement of retaining wall elements, water runoff into local waterways, and significant ponding directly behind homes, whereas some nearby residents rely on private wells for drinking water, whereas the medical officer of health has reviewed mercury levels based on testing conducted to date and has assessed those levels as not warranting immediate concern, while also recognizing community concerns and referring the matter to the Ontario Ministry of the Environment, Conservation and Parks, which subsequently referred the issue back to Ottawa Public Health. And whereas Dr. Heather McNairn has identified that testing for additional contaminants of concern, including arsenic, cadmium, and methylmercury, has not yet been conducted and is necessary for complete understanding of site conditions, whereas methylmercury is a bioaccumulative form of mercury associated with serious neurological harm, and its presence or absence on the site has not yet been established. And whereas Stephen Quigley, professional engineer who has previously reviewed testing on the site and has testified at the Ontario Land Tribunal, has recently raised concerns regarding the adequacy of that testing. And whereas the City of Ottawa's independent engineering consultant, WSP, has concurred that additional contaminant testing is required and has identified that existing testing is geographically incomplete, including with respect to tees, greens, and pond sediments. And whereas in the absence of complete site-wide contamination data across all relevant contaminants and areas, any public health risk assessment necessarily reflects an incomplete evidentiary picture. And whereas significant earthworks continue daily immediately adjacent to residential properties, and whereas WSP is currently engaged in site monitoring, providing a measure of ongoing oversight, and whereas the Ottawa Board of Health has a mandate to protect and promote the health of Ottawa residents, therefore be it resolved that the Board of Health direct the Medical Officer of Health to review and update the current public health risk assessment for the site and adjacent residential areas, having regard to WSP's findings and other available expert reports on contamination testing received by OPH or the City of Ottawa's Planning, Development, and Building Services branch to date, and clarify how OPH investigates health hazards and monitors potential site conditions, including active disturbance of incompletely characterized lands, standing water, and proximity to residential properties, under what circumstances OPH can intervene, and report back to the Board of Health with a copy to City Council no later than its next regularly scheduled meeting, with a summary of the updated public health risk assessment and a description of any health monitoring protocols in place or recommended beyond current oversight. Thank you, Chair.
Thank you, Member Gower. So we will have an opportunity to debate the motion and ask questions to staff. But we have Councillor Curry is here tonight and has requested to delegate. So we can waive section 65(3) of the board's procedure bylaw to allow Councillor Curry to address the board. So again, we can carry that, or if someone wants to vote on it, we can, but is that carried?
Great.
Okay. So we'll invite Councillor Curry up to the mic.
Thank you very much for all that procedural stuff, new to some. Thank you very much, everyone. Chair Kitts, members of the board, thank you for the opportunity to speak to you today. I'm the City Councillor for Canada North, and I want to talk to you about some of the people that I represent. The residents of Canada Lakes are frightened. They are watching heavy machinery disturb contaminated soil directly behind their homes. They're sending me photographs of what look like small lakes forming on a mercury-contaminated site with no approved drainage solution. They have found coyotes dead and dying on the site during active soil disturbance that they have never seen before. They are reporting cracks appearing in their foundations. Some of them rely on private wells for their drinking water. Some of them have written to me, to their MPP, to their MP, to the mayor, and to Dr. Arneson. I began corresponding with Dr. Arneson about their concerns in February. I want to be respectful in saying that I was surprised this board had not previously been made aware of the extent of community concern on this file. I'm here today because these residents deserve to have this board fully informed and fully engaged. I've provided 6 documents for your consideration. The WSP peer review of the preliminary engineering investigations memorandum dated February 23rd, 2026. The WSP peer review of Phase 1 and Phase 2 environmental site assessments from March 2nd, 2026. A report from Dr. Heather McNairn, a senior federal scientist, identifying untested contaminants of concern, including arsenic, cadmium, and methyl mercury. Follow-up letter from Dr. McNairn, a letter from Stephen Quigley, PEng, who testified at the Ontario Land Tribunal that the proponent's environmental testing was inadequate and who has written again to raise ongoing concerns. A letter of concern dated April 18th, 2026 from a group of professional engineers and scientists, including Dr. McNairn, raising a new and urgent concern. That concern is that the engineering drawings associated with current site activities do not appear to bear professional engineer's seal as required under Ontario's Professional Engineers Act. That seal is how Ontario law establishes who is legally responsible for a design. Without it, there is no publicly identifiable confirmation that a licensed engineer has taken responsibility for ensuring the safety of what is being built on this contaminated site. What is being built matters enormously. Bioswales and infiltration systems, infrastructure specifically designed to move water through the soil, are being installed before the contamination on this site has been fully characterized. WXP has confirmed that testing is geographically incomplete. Methyl mercury, the toxic bioaccumulative form associated with serious neurological harm, has never been tested on this site, and the water from this site flows to the Beaver Pond, through Kizzle Creek, through federal NCC lands, and into the Ottawa River. Dr. Arneson wrote to the Ontario Ministry of the Environment, Conservation and Parks to raise these concerns before more disturbing, widespread evidence was reported. The MECP referred the matter back to Dr. Arneson. The normal regulatory safety net has not held on this file. The City of Ottawa does not have, and staff say they do not have the authority to stop this work. I understand that the medical officer of health and this board does have that authority. This board has a duty of care. When human health is at risk, known documentation of contamination is known, you must apply the precautionary principle. And I want to ask each member of this board and our Chief Medical Officer of Health a question I ask in complete sincerity. If a child in Canada Lakes becomes ill, will this board be seen to have acted with a duty of care? Will it be seen to have applied the precautionary principle, the foundational public health principle that says when the evidence of harm is incomplete, you act to protect, not wait for proof? If this were your backyard, if this were your well, your foundation, your child playing near that standing water, what this board does today be enough? The people of Canada Lakes are asking you to act with the same care you would want for your own family, and they deserve nothing less. Thank you.
Thank you, Councillor Curry. Member Carr, is your question for the delegate?
I have questions. We'll do questions of the delegate first and then questions for staff.
Yeah.
Okay, for the delegate. You mentioned flooding, I think, as part of that. Is that related to the contamination?
It is because on the golf course, what was the golf course, there are huge ponds, and when the chemicals that were put on the tees and greens were put on there, 40 years ago, they were full of mercury. So what happens is that watershed ends up in those ponds, and so the sediment at the bottom of the ponds is mostly the sediment of mercury, cadmium, arsenic. And we're very concerned methyl mercury. So what the developer has done, because nobody could stop the developer, is they've taken a section of the pond and it has started to drain out into another part of the course that then goes into waterways, which then goes into the creeks and streams, into the Kizzel Pond, into the Kizzel Creek, into the Kizzel Drain, and out to the Ottawa River. So the flooding on the course from all the rain required them to do that, and now all of the contaminants are now spreading.
Okay, thank you. I think the remainder of my questions are for staff.
Okay, thank you very much. Member Dudas.
Yes, thank you very much. I'm just trying to wrap my head around it, and I saw through the motion that there are actions included in that. You spoke to the role that OPH has played to date, which hasn't really been a role in this process. Is the actions that are in the motion sufficient to meet the needs of your community, or are you looking for, what are you asking for OPH to do in terms of steps going forward?
So I think that what the community is so upset about is that nobody seems to be acting, right? That is the biggest problem, and that it's not clear who has the power, what threshold would be reached, that something could actually be done to stop this. And, as I said, they're writing to everybody. I think what this motion lays out are three things that could really help. I think there are other letters that could be written. I think, letters seem to be, or emails seem to be the main form of power here, but I think there are more that could be written. I don't know what this board thinks about its own, if it ever writes letters itself or joint letters. But at least at a minimum, what this motion lays out is getting some clarity for the community and trying to determine what would have to happen before someone would actually say that they need to stop and do the testing before they allow anything further to go on. That's the problem, right? We now know that the testing was done wrong. It was incomplete. It wasn't even done in the areas where the mercury is known to be predominantly, and yet the work continued. So what this motion is doing is getting at some of that, because Dr. Arneson, when he was looking at the levels, was looking at old dated information, and now new information has come forward.
Okay, thank you very much. I will have questions for the doctor.
Okay, I'm not seeing any other hands up for the delegate, so thank you, Councillor Curry, for being here. Okay, we will go to questions to staff, but I think Dr. Arneson, did you want to comment?
Yeah, thanks. Thanks for the opportunity, and thanks for the delegation. I just want to provide some additional information for board members about public health responses to health hazards and this issue. We do respond to many public health hazards according to the legislation, but in Ontario, environmental site conditions and the contamination issues that are coming up here are governed primarily through the provincial legislation and regulations like the Environmental Protection Act and the Ontario Water Resources Act, and those are broadly administered by the Ministry of Environment, Conservation and Parks. Developers are legally required to assess environmental conditions, manage contaminated materials appropriately, and comply with any applicable site remediation or risk management requirements before they proceed with development. These are the obligations that exist to protect public health as well as the environment, and they're not discretionary. And the legislation and its enforcement are important for protection of public health through prevention of exposure to contaminants. The role of the Board of Health and the Medical Officer of Health as it relates to health hazards outlined in the Health Protection Act and Promotion Act Section 11 is to receive and investigate health hazard complaints related to occupational or environmental health. Under this section, the Medical Officer of Health must notify the appropriate Ontario ministry that has primary responsibility and investigate complaints in consultation with that ministry to determine if a health hazard exists. OPH's requirement to investigate environmental health hazards is further guided by the Health Hazard Response Protocol, which is under the Ontario Public Health Standards, and that sets out the expectation for identifying, assessing, and responding to potential health hazards in collaboration with the relevant community and government agencies and ministries. So in relation to this issue, the 7,000 Campo Drive site, OPH has responded to multiple inquiries and concerns from community members that would meet the definition of health hazard complaints. As required under the HPPA, OPH consulted with the Ministry of Environment through the Regional Director, Tracy Hart. The Ministry of Environment indicated that they do not have a direct oversight role at this stage of the project, as the work is being done as part of the municipal planning, which is overseen by the municipal planning process by the city, and it's being done to update the environmental site assessments at that site. The ministry stated that the city's work through the Planning, Development and Building Services Department aligns with provincial expectations and appear appropriate, and they said there was no current need for additional Ministry of Environment oversight. In addition to provincial oversight, as mentioned, the city has implemented the engagement of a WSP, a qualified third-party environmental consultant, to provide independent technical oversight and verification related to the work occurring at the site. And that is ongoing throughout the development process and intended to ensure compliance with the applicable standards. So to date, the Ministry of Environment has not requested OPH to take any public health action or reviews related to the work at this site. And they indicated that they would continue to monitor the situation and advise us if the situation changes. We've also made some efforts to support accurate communication with the public, including evidence-based information on mercury as a health hazard and guidance on ways to reduce the risk of exposure. And we'll continue to respond to inquiries and complaints, sharing available information within our mandate and working collaboratively with the city departments to ensure we're doing coordinated responses to those inquiries. I want to say whether, we proceed with the motion or not, we will be continuing to monitor this matter within our legislated role, and we always have the ability to take any action that's appropriate within our mandate under the Health Protection and Promotion Act. Thank you.
Okay, great. Thank you, Dr. Arneson, for that added context. So we'll go to questions for staff. Burkhar.
Yeah, thanks very much, Dr. Arneson. Just a question about liability. Like if someone gets sick as a result of this activity, is there liability for public health?
I think, that might be the best answered by the legal counsel, Omar, in terms of opinion on liability.
With respect to liability, it's largely hypothetical. Anyone can bring a claim against the Board of Health and for any particular cause of action. I haven't had an opportunity to review the matter, but as Dr. Arneson has explained, with or without the motion, he has expressed that staff and himself, they're going to carry through with their mandate under the HPPA. Yeah. So regardless, the medical officer of health has indicated that he's going to follow through with any future complaints and investigate the matter pursuant to Section 11 of the Health Protection and Promotion Act. As such, he and his supporting staff will be fulfilling their duty under the HPPA.
Okay, thank you. I think I got that. Is there anything that you as the medical officer of health can do to assure residents that, the children are safe to play outside, or any other initiatives that they could be taken?
Yeah, so thanks for the question. We've provided some information around mercury in terms of how people can be exposed to mercury and the health concerns around mercury. There has been some suggestion around certain interventions like masking or other personal protection, which there's no public health evidence that that is an approach that would be used in an occupational setting or anything related to preventing exposure to mercury. So we've provided some information, but I think the crux of the problem is that the responsibility and the oversight and the legislation is within the Ministry of Environment, and under our legislation, we're required to work with them to work on the investigation, and we may not be privy to all of the information that's available to them or is the most up to date. I think that's one of the main advantages of this motion. It will enable us to get some clarity around the information that is being provided around some of the things that are cited in what we heard today. And we can review all of them. But ultimately, I mean, we have our obligations under the Health Protection Promotion Act, which we're fulfilling. And then the Ministry of Environment has their legislation that they need to enforce. And that is where the expertise lies around things such as the engineers, the soil specialists around what they're talking about as it relates to environmental and building and development, whereas ours relies on the expertise around the health impacts of specific health situations, not hypotheticals.
Okay, thank you.
Thank you, Member Carr. Member Dudas.
I'm just trying to wrap my head around this. So the World Health Organization lists mercury as one of the top 10 chemicals of major public health concern. It accumulates in the system. I mean, I'm not telling you anything you don't know, doctor, but there's damage to nervous systems, digestive, immune systems. It's intrusive at the best of times. I'm just trying to figure out why it is that, one, this board is only hearing about these very real public concerns in a part of our city now. And two, why is it that, and I understand jurisdictions and authority, we are in part, a body extension of the province. Why are we not more involved in this? I know you went through all that, but maybe from a layman's perspective, why is OPH not more engaged in at least addressing the public's concerns in respect to this?
I'm sorry, I couldn't hear the last half of the sentence you said there. Why is OPH?
Sorry, maybe I'll just sum it up. Mercury is dangerous and people are concerned. So why are we not more involved? And I get it. You've gone through all the legal jurisdictional things.
Yeah.
Just tell me from a layman's perspective, why are we not even more communicating?
I think it's important that people understand that mercury, the presence or absence of mercury does not tell you anything substantial about the health risk of it. So mercury is a naturally occurring element. It occurs in the environment. So mercury in its metal form is present almost everywhere. It's present probably in every construction site. And actually the levels that the Ministry of Environment uses refers to background levels of mercury, which is actually mercury levels that they would expect to see in the soil because it is present as a chemical. So the challenge is just simply the presence of a chemical is not enough to indicate that there's a health hazard. There has to be some reasonable mechanism of exposure, a reasonable way that an individual would have the health impacts from an exposure. And until we have evidence that there's a plausible exposure route, worrying about mercury in one location that's tested does not really, it's not really something that we can ascertain the health risk. Mercury is present also in many many foods within the food chain. The most common exposure of people is mercury in fish. People consume mercury in fish, and as was mentioned in the delegation, it's actually the methylated form of mercury that is really the health concern. And the reason that we don't bring every health hazard concern to the Board of Health is because we receive many complaints of health hazards, and it's a core part of our operations. We just like we don't report on every vaccine that's given, except in the numbers, as we did today. We can't operationally report on every single health hazard investigation. There's a team that works hard on these all the time. However, we could look at improving our general reporting to it in the annual report or regularly around these numbers if the board is concerned that they're not hearing about these enough. We could look at that. But on this particular one, we don't actually have the necessary information to say that this is a situation that is substantially different than any of our other health hazard responses.
So one of the things that I wanted to ask you as well too is I know that in Ontario there are some public health units that get involved in land use planning, specific to ensuring that contaminated groundwater doesn't occur through new developments. There's responses to water quality concerns. They're very involved in developments. This is a very unusual circumstance where the municipality has not necessarily endorsed this development, so it's a bit out of the norm. So I have a two-parter question here for you. One is this something, not necessarily because of this circumstance, but just in general, we should ever consider engaging in as OPH, as the board? And two, in respect to this particular incident, I'm having a hard time understanding why, when there is a real public concern, and to your point, Dr. Artisan, maybe it is unfounded, maybe the numbers aren't showing that, but people are concerned. And it's interesting because we have this delegation coming to us, but I have also been receiving emails from people in this community who I do not represent, sharing their concerns about this particular potential exposure. So how do we take off the hat of protecting community safety, allaying concerns about health and safety, and saying that we don't have enough data here to proceed and we're being restricted by our jurisdiction? Like, I'm sorry to put you on the hot seat. I'm just trying to square this circle. So.
Yeah, I would say, I mean, we don't in Ottawa, we don't have a role in planning and development in terms of assessing environmental health risks. I'm not familiar with the health units that you're referring to. But our work is governed under the Ontario Public Health Standards and the Health Hazard Response Protocol and the Health Protection Promotion Act, and our role is pretty clear in there. And beyond that, I do trust the legislation, the Environmental Protection Act, the legislation that protects our water as the means of protecting public health from environmental contaminants. That's why they're there. And I don't have any evidence to suggest that those mechanisms are not working to protect us from environmental contaminants through the planning and development process.
Okay. No, I appreciate that. And I'll actually share the report that I have. It's that speaks to the public health units that are involved in it, just so you have it. I'll do that after this meeting. I fully support this motion. I think that it's prudent for us to allay concerns and to be more engaged in this process. I do understand that there are jurisdictional boundaries, but I will be supporting this motion because I think that it's warranted and I think it's important. Thank you very much, Chair.
Thank you, Member Dudas. Member Gower. My apologies. We have to have a motion to extend the meeting. Member Carr.
Thank you. This is procedure to extend the meeting. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Is that carried?
Carried.
Great. Thank you. Member Gower.
I guess it's more of a wrap up, and I appreciate what Councillor Curry is doing here, because there's a significant health and safety risk in her community, and there's very fuzzy, unclear chain of responsibility at several levels of government, municipal and provincial. Maybe there's a federal role too. And I think why this motion is useful is that it's going to clearly document the role of Ottawa Public Health, what they've done so far, what their responsibilities are on an ongoing basis, and have that in a way that's simple for the local councillor to be able to communicate back to residents. What I'm hearing, and please, Dr. Arneson, correct me if I'm wrong, Ottawa Public Health has done assessments based on evidence available so far on the site. Will continue to update assessments based on new evidence that is available now and that may become available in the coming days, weeks, and months. If there is a requirement for an alert to the public about significant health and safety concerns, Ottawa Public Health, in conjunction with the provincial ministry, would be able to communicate that to residents, to the public, to the councillor. There is a role for OPH. There is a role for the ministry. There's a collaborative process there, but OPH also has the ability to act independently of the ministry if required. Is that correct? Yeah.
Yeah. So
Can you comment or add?
Yeah,
any
I
nuance to
think
that?
yeah, I think it's we do have the authority to act under the Health Protection and Promotion Act for health hazards. But in these circumstances, it does specifically outline our obligations to work with the ministry who has the primary responsibility within the Act itself. I think, I think the challenge with predefining what exactly how we act in health hazard responses is you have to go through a range of various hypothetical scenarios or various scenarios that could happen. And it's very hard to, under the protocol, to respond to something specifically. I think the point that was made by Councillor Curry that there is maybe new information that we didn't review as part of our investigation is a good one. We received a lot of information from different parties at different times, and I'm not certain that we have had the opportunity to review all of it as it relates to a single assessment. That is because of the way the Act and the protocol is laid out, that we respond to specific complaints and investigate specific complaints. Yeah, you're correct that it would probably be advantageous to have a single assessment that could be available to others around what exactly we have done. The other thing I'd like to mention too is we do have some constraints around in the legislation around what we are allowed to provide publicly as it relates to health, because personal health information may be shared as parts of complaints, and we are not permitted, as per the Act, to provide that information publicly beyond the complainant. So we have to follow those rules. But beyond that, I think there would be benefit of having a review of everything we've received to date, working with our planning partners to make sure that we haven't missed any of the documents or pieces of information that are relevant.
Okay, thank you. And I believe the Councillor Curry is also hoping to meet with the MECP And I know the chair has also offered to help facilitate. I think that'd be incredibly helpful too. If anyone from the MACP happens to be watching, a meeting with the counselor, with our medical officer of health, with the chair, just to give some assurance to the public that there's somebody watching over this and paying attention and ensuring that people are safe. I think that's a reasonable request from Councillor Curry and from residents in this area. Thanks, Chair.
Thank you, Member Gower. I'm not seeing any other hands, but very well said. So I do think that this motion will provide some clarity, as Member Gower was just outlining, and hopefully some, comfort to the residents of Canada and to the councillor that this is being taken seriously and assessed. So with that, is the motion carried?
Carried.
Great. Thank you very much. Okay. We're almost. Okay. Confirmation bylaw, Member Carr.
Be it resolved that confirmation bylaw number 2026, number 2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 20, 2026 be read and passed.
Is that carried? Wonderful. Do we have any inquiries? Seeing none, we are adjourned. The next. Do you have an inquiry? Okay. Last call for inquiries. Okay, we are adjourned. The next meeting is Monday, June 15th. Go Sens go. Thanks, everyone. Have a great night.